to get domestic companies to procure and contribute personal protective equipment, also known as PPE. Those are the things, the equipment needed by medical staff inside hospitals to stay safe. All of those obviously needed by frontline workers in the fight against COVID-19. There does seem to be a shortage around the world. The government said it is working hard to make sure there's enough in this country and build the federal stockpile for provinces that feel that they do not have enough. I think we have a shot of Rideau Cottage, the Prime Minister's home, where he is, not yet, where he is continuing his self-isolation at Rideau Cottage, expected to speak to us at 11:15 Eastern, and we will carry it live, of course. Let me bring in my colleagues, Power and Politics host Vashi Kapelis and CBC's David Cochran, to join me now. A couple of little updates just in terms of where things sit in the country before we get started to both of you. Ontario has now extended its provincial state of emergency by 2 weeks. We're expecting to hear more information today about school closures here in this province in Ontario. And I will say that yesterday Ontario had 351 new cases on one day alone, and that's the largest single day increase since the outbreak. Important to remember, I guess, that those cases reflect history rather than the future. But the fact that there are more cases speaks to a couple of things: community spread, more testing, and the fact that Ontario lags behind some other provinces in that testing, including Quebec, BC, and Alberta. All right, Vashi, what are we thinking we'll hear from the Prime Minister?
So a couple of things, and you highlighted the first, Rosie, that is the procurement update. So by procurement, I mean, remember, I think it was last week that Navdeep Bains, the minister in charge of this file, put out a call, basically said, we're retooling the Department of Industry to completely focus on COVID-19. We are expecting an update from the Prime Minister and then later Minister Bains on those efforts. So which companies, for example, have been retooled, which programs have been retooled, and to what degree, and what results can Canadians expect from that? Will it be things like personal protective equipment, things like ventilators? We've seen that discussion ongoing in greater detail in the United States, so expect those kinds of details today. Apparently, there are also some companies that we can expect. For example, Home Depot. I don't know the exact specifics of what they are donating, but there are some sort of corporations in this country and outside of this country that have stepped up and are going to be sort of announcing through the Prime Minister today donations of that kind of medical equipment or personal protective equipment. So stay tuned for that. I think we're not going to hear a lot from the Prime Minister on this, but we are very eagerly, and I think many business owners very eagerly awaiting more details today. We were promised they were coming around qualifications for the big announcement they made last Friday and then updated yesterday where business help is concerned. So that's the big wage subsidy, up to 75% of wages, no limit on the number of employees. However, the big sort of qualifying factor that the Prime Minister announced yesterday was a 30% decrease in revenue. We have no idea at this point how that's going to be measured. A lot of business owners saying, well, that's difficult to show right now. It's only been a few weeks, or they've closed down completely. How does this apply to them? Again, those kinds of questions about how they'll be able to access it, how quickly they will be able to, those persist. And we are anticipating, well, we've been told to anticipate some answers from the finance minister that we don't know at this point when. I think those will continue to be questions, and obviously until they get answered. Lots of people anxious about that help.
Yeah, those details supposed to come at some point later today from the finance minister or other ministers, not at the noon briefing from what we understand, but some critical questions there for the many businesses, now small, medium, large, no matter what size you are, who are hoping that they can tap into the wage subsidy as an attempt, as we've talked about before, to keep that connection between the company and the employee and make sure that things can get back up and running very quickly once this is all over, because it will end at some point. I will just say that we do have confirmation now for Ontario parents and students that senior government sources confirm school won't be back for Ontario students until at least May. So that people can start planning their lives around that. I'm sure that's not terribly surprising for most people, but that's how things are looking in this province, and I would expect other provinces will get updates as they see how they're containing and handling the cases throughout the country. David, anything that you're watching today?
Yeah, a couple of things. To build on what Vashi talked about companies stepping up to help with the procurement, I don't know the specifics of what Home Depot will be announcing today, but I know Ontario Premier Doug Ford said that he had been speaking with the head of Home Depot Canada, and there was offers of supplying masks, for example. I mean, the masks that contractors use if you're doing a lot of sanding and stuff that puts particles into the air, drywall work, those are either completely identical or very similar to the sorts of things people use in hospitals. And there are supplies of things like that exist for industrial work that can now be redeployed for medical work. So we are seeing examples of that from the private sector across the world, really digging into their stockpiles and contributing to the national effort against COVID-19. One thing about Bill Morneau, we should mention, there is a report out there that he is self-isolating because of contact with a UN official who later tested positive for COVID-19. That is partly right, partly wrong. He did have contact with this official, but it was more than 20 days ago, and the finance minister, we're told by his office, is self-monitoring, not self-isolating. No symptoms, and it's over 20 days now since that contact happened, so you would be outside the incubation period for COVID-19. When we do hear from him, as Vashi said, we are waiting sort of the critical details from him and the small business minister, Mary Ng, on exactly how this massive wage subsidy they announced yesterday, the scope and scale of which really is hard to understate. They're essentially putting hundreds of thousands of Canadians on the government payroll by flowing money through their companies to keep them employed. The 30% revenue drop is one that I know all of us have had a lot of questions about on Twitter or on email. How exactly is this going to work? How do I prove this? Do I have to provide a financial statement? My understanding from speaking with senior government officials is that this is almost going to be a pay first, ask question later type of program, like they're doing with the CERB and getting money to people. There will be a compliance work done after the fact where they look at and see if you really did have that 30% revenue drop. If you had a substantial drop but didn't hit that threshold, likely you would see some form of repayment, either partial or in full, based on whether you needed this subsidy or not. And if there is a deliberate attempt to rip off the government and rip off the taxpayers, as the Prime Minister said yesterday, there would be significant consequences. So I don't think the intent is to make it laborious and create a high hurdle up front for people to qualify for this. They want to get cash out the door.
Okay, a couple updates about Bill Morneau. So you're quite right. He is self-monitoring. This is attached, as you said, to this meeting with an executive director of the World Food Program, but it happened on March 11th. So there's not much concern about things, only that he has no symptoms, he's in good health, and we are told he will be at the announcement for the wage subsidy later today, whenever that takes place. We're waiting for a time on that, and we think it will happen in Toronto. I know a lot of businesses, too, asking about the fact that tomorrow is, of course, April 1st, which is a concern if you are a renter personally, but also a concern if you lease a place for your business, and there have been questions about whether the federal government should do anything more there. The federal government's response to that would be, that's why we've offered $40,000 in loans, interest-free, with $10,000 forgivable. That's why we've offered more ability to credit through the bank, the Business Development Bank of Canada and EDC as well, to try and provide that credit to extend your ability to stay within your place of business. So I know that's on the minds of lots of people, but that's sort of the response for now. I'll put you both on hold just for a moment as we wait for the Prime Minister. There have been 3 more deaths from COVID-19 at a nursing home in Ontario. 12 residents have now died of the virus at the Pinecrest Nursing Home in Bobcaygeon, and 1 volunteer, bringing the total number of deaths now at that facility to 13. A woman whose mother died at Pinecrest spoke to the CBC and shared what it feels like to lose a family member to the virus.
It makes it difficult to grieve because the whole world is involved. It's like your parent or your person is, in the press, and it's a big thing, and it definitely changes your ability to just be with what's happening, which is you've lost your mom. And I've been very lucky because my mom was 82, and I'm in my peer group, most of my friends have lost their parents already, so I had her for a good long time, but I didn't want to lose her without being able to be with her. And that was, for me, the hardest part.
Of course, this is one of the concerns of public health officials, that COVID-19 gets in amongst these vulnerable populations into nursing homes. We saw that outbreak happen in British Columbia. Now we're seeing it in Bobcaygeon, 150 kilometers northeast of Toronto. And that's where Chris Glover is standing by outside that nursing home there. So it does seem fairly grim there, Chris, not only on the number of deaths, but also the number of workers who have potentially been infected as well.
Rosemary, it certainly is grim, and that uneasiness is certainly starting to settle in with a lot of the residents that I've been speaking with here in Bobcaygeon, especially as they learn that these numbers continue to rise in this small town just a couple hours north of Toronto. And we know that the virus has claimed, as you mentioned, 13 lives. The fear, though, is that that number could still rise. The medical director at this facility behind me says that many of the other patients and residents at this facility are also showing symptoms, and some of them are in critical condition. So her concern is certainly that there will be more deaths. But you also mentioned the staff, and it's true, there are several staff members, at last count some 24 staff here, who are sick, and many of them are off sick. So as a result, the province and nursing organizations and associations have had to step up to get some reinforcements here to help with the sick and the dying. And the thank yous are also pouring in, not just from officials, but also from residents in town. There have been cavalcades of cars driving past here, honking horns like you just heard there. But yesterday at around 7:30 p.m., just like we've been seeing displays right across the country, Rosemary, last night here at this facility, there was a cavalcade of vehicles that drove by playing music. Some had their windows down, they were waving. Some of the staff members from inside the nursing home came out to kind of wave and say thank you as well. It was a beautiful tribute. I was speaking with one resident who said it made her feel proud to be from Bobcaygeon. It made her proud to be a Canadian, to see so many people stepping up and saying thank you for this important work that's going on in this building behind me.
Okay. Chris Glover in Bobcaygeon, Ontario right now. Thank you so much for that. I appreciate it. We want to bring you a view from what it's like in another way on the front lines of the pandemic. Dr. David Carr is emergency room physician for University Health Network in Toronto. And as we wait for the Prime Minister, he joins me now. Good to see you, Doctor.
Hi, thanks for having me.
Thanks for being here. So tell me what it's like to work in an ER right now.
Yeah, it's different times. Certainly nothing.
And then let's just you and I
envisioned in terms of how things are. It's frightening. Most of us love what we do, and right now being an emergency doctor is a bit frightening. And it's changing day to day, and it's also hard because we just are trying to keep pace with the knowledge. And as it evolves, we're kind of on the front line being there.
We're just about to hear from the Prime Minister, we expect, about companies in Canada stepping up to make equipment that you probably need. What's the state of things right now? Do you have everything you need in terms of personal protective equipment?
Yeah, I think at the current moment, I certainly feel safe working and showing up to work. When social media is a powerful enemy and a weapon, and that you see other countries and their experiences. You hope that we have what we have. It's not very Canadian to rely on privatization in the private sector, but we need to now. We need all the help. It's all hands on deck to know that as frontline physicians and nurses, we have what it takes to effectively treat patients safely.
You said it's frightening doing your job. I can't imagine having to go to work and being scared at work. What is so frightening for you right now?
Yeah, I mean, frightening in that there's an unknown. Most of us are trained in a time where, we've seen cases of meningitis, tuberculosis, necrotizing fasciitis, and flesh-eating disease. Like, we know scary infectious diseases, but we have a history behind those, and we know what to expect. And I think the unknown is frightening. Look, when you see 10% of the Italian epidemic as healthcare workers, we're concerned. But I feel like we've been responsible in doing what we can to protect our workers. I just think that we need to know that we have it. Is it frightening? Sure, because we never want to bring that stuff home.
So how are you doing that? How are you mitigating work life and what might be happening there, and then coming home and making sure your home life is safe?
Yeah, look, it's a balance. Certainly our house has turned into a hot zone and a cold zone. I'm not laundering any of my clothes anymore. Certainly wearing scrubs, disposing them in the hospital, really meticulous detailed hand wash, and then coming through a separate entrance to the house, going directly, regardless of all hours of night, leaving stuff in the garage, direct to a shower, and not seeing my loved ones until I've decontaminated at home, despite making a tremendous effort to decontaminate at work as well.
Does that? How are your family members? I don't know if you have kids or your family. How do they get what's going on? Do they understand why you have to be so careful?
Yeah, we have kids and they're wonderful and they get it. And the most comforting thing for us as parents is the fact that we really firmly believe that children do well. My kids are school-age kids and I don't have worries for their health. What I want to do is make sure we keep my parents safe, make sure we keep the community safe. But we have frank discussions, whether you're a healthcare worker or not. You have more time with your kids than you've ever had. Now is the time to engage them and to talk to them. This is a tough emotional and psychological effect on our children. They're not used to staying at home, and we got to be there to mitigate what is really affecting them, which is a really big adjustment in their lives.
I'm waiting for the Prime Minister, so I may cut you off, and you'll excuse me if I do. But let me ask you this: how is this different, this virus, than what you've seen before? And what is the thing that you're seeing people try to deal with that is most troubling to you?
I think what's different, and having gone through SARS at the start of my career, is that we are seeing asymptomatic transmission. So people don't know they have it and they can spread it. And one of the challenging things, and I think this is the key point, is the real heroes of this disease are the people watching TV. They're not the healthcare workers. Unfortunately, we've always been brought up in a society where you go to your physician assistant, your nurses, they help you, they give you medications, they get you better. We don't have a lot of options. What gets you better is to prevent getting the disease in the first thing. And we really need to just keep pushing through this social distancing.
Okay, the Prime Minister is up, but let me tell you, it's not just the people watching TV that are brave, it's also you. Thank you very much, Doctor. Take good care. And here is the Prime Minister of Canada.
New crisis. Families and loved ones continue to grieve and seek answers. I want to ensure them and all Canadians that we have been working hard to get accountability and justice, even as we fight this pandemic. At the same time, we've also been developing a strategy with our other international partners to make sure that such a tragedy never happens again. Today, I'm appointing the Honourable Ralph Goodale as my special advisor for Canada's ongoing response to the downing of Flight 752. With his decades of extraordinary service to Canada, including as Minister of Public Safety, Ralph has the right expertise to guide our response to this air disaster and provide recommendations for best practices going forward. He will also continue to push to see families properly compensated. The second thing I want to do is share a story with you. A few weeks ago, Dave Caputo, the owner of a startup in Trustcore in the Waterloo region, called a meeting with his employees. With mounting concerns around COVID-19, Dave asked his team how they could repurpose their building materials factory to make products hospitals needed. A few days later, they had 4 prototypes drawn up. They decided to make large panels, which hospitals could use to subdivide rooms and isolate people with COVID-19 from other patients. Well, on Monday, panels made of fully recycled materials were delivered at no cost to several hospitals in the region, including Grand River, St. Mary's, and Guelph General Hospital. Dave and his team showed what Canadians do in difficult times. We don't back down from a challenge. We roll up our sleeves and we get to work. I know that this pandemic has been incredibly challenging for people right across the country, but we're also seeing the best of what it means to be Canadian. From coast to coast to coast, businesses are retooling to produce face shields, ventilators, hand sanitizers, and other supplies our healthcare professionals need. To make it easier for companies to help out during this critical time, we launched Canada's plan to mobilize industry to fight COVID-19 a little over a week ago. In the time since, we've spoken directly to almost 3,000 companies who've reached out to offer their help. Before we go any further, I want to thank all the owners and entrepreneurs and managers who've answered our call to action. This vital support comes at a critical time. And the way you looked around and said, not how can I keep myself safe, but how can I keep myself and my employees safe and help out in this critical time, is a real sign of leadership and a sign of what Canadians do best. In tough times, we pull together, we're there for each other, we put up our hands and we ask, how can we help? I also want, in the same vein, to thank everyone who's making, shipping, and delivering these products. People who work on the manufacturing sector and in terms of getting people the items they need are on the front lines of this fight. Our country needs you through these tough times, and we thank you deeply for everything you do.
When we announced the Canadian plan to mobilize industries to fight COVID-19, we said that we were reaching agreements with Thornhill Medical, Medicom, and Spartans Bioscience. Today, we are announcing the signature of supply contracts with those three Canadian companies to manufacture medical equipment such as respirators, surgical masks, and other diagnostic materials. Minister Baines played one of the foremost roles in making this happen. We have also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. By mobilizing industry, we can produce the goods that are needed by our healthcare professionals right here in Canada in order to protect their health, to protect other patients, and to stop the spread of the virus.
Mobilize industry. We said that we were close to reaching agreements with Thornhill Medical, Medicom, and Spartan Bioscience. Today, we're announcing that we have moved forward with contracts with these 3 Canadian companies to make medical supplies such as ventilators, surgical masks, and test kits. I want to recognize the great work Minister Baines has done to make this happen. We've also signed letters of intent with 5 other companies: Precision Biomonitoring, Fluid Energy Group, Irving Oil, Calco Group, and Stanfields. We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today, I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed.
A number of companies have also donated equipment and medical equipment to fight COVID-19. Alibaba sent us 500,000 surgical masks and 10,000 testing kits to help us. The group, COVID-19 medical group that brings together engineers, entrepreneurs, and other health care professionals, is working with a number of companies to provide medical equipment. Up until now, they have been able to get a commitment from Bombardier, 3M, and Medtronic to produce personal protective equipment. And Toys R Us has pledged to provide monitors for babies so that there can be better communication between patients and healthcare professionals. Those monitors will also help to reduce unnecessary travel within the facilities. I want to thank the many companies who have made a donation for their leadership and generosity. You are doing your share, and all Canadians will have to follow your lead.
That we will need more masks, ventilators, and testing kits. But how many more we need depends entirely on you. If you stay home and follow public health recommendations, you can slow the spread. And that means fewer patients in our hospitals, fewer people to test, fewer ventilators to use on critical patients. So keep doing your part and help us keep Canada safe. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. Nous allons commencer avec la période de questions par téléphone aujourd'hui. Modérateur, c'est à vous.
Thank you. Merci. The first question, Maura Forrest, Politico. Your line is open.
Thank you, Prime Minister. Yesterday you were asked about pipeline construction continuing on the Trans Mountain expansion, and you said you'd have a better answer today. Now Jason Kenney is saying construction will start on the Keystone XL pipeline as early as April 1st. Do you have concerns about construction continuing on these projects? Do you think it should stop?
I can assure you that Crown corporations, all Crown corporations, are following all the best medical advice. Je peux vous assurer que toutes les compagnies du gouvernement sont en train de suivre
Crown corporations are following all the advice provided by our medical experts.
Politico?
Yes, I mean, that didn't really answer my question. I guess that means you're comfortable with construction continuing. But my follow-up question is about the wage subsidy. You initially promised it at 10%, then last week it was hiked to 75%, but still seemed to be targeted towards small and medium-sized businesses. Now it's available to all businesses. I'm wondering why you've taken such an incremental approach to this measure, given that you're now asking employers to hire back people that they've already laid off.
This situation has been evolving rapidly, as we all know. We're putting in place unprecedented measures to respond to the needs that people are expressing on how we're going to be able to get through this together, how we're going to be able to stay home, self-isolate, not go into work, and yet still be able to pick up our economy when we're through this particular crisis. That is the focus that we've had, and that's why what we're offering is a 75% wage subsidy to companies large and small, nonprofit sector and charitable sector included, so that people can stay on the payroll while they stay home and stay isolated, so that we can ensure that we do bounce back strongly from this once we're through this period.
Merci. Prochaine question.
Thank you. Merci. Next question, Mike Mansfield, the Canadian Press. Your line is open.
Good morning, Prime Minister. You talked about shipments coming in the coming days and the fact that more will be needed, obviously. So I think what I'd like you to do is, can you walk us through your decision-making process around the cabinet table, how you decide how these scarce medical resources will be allocated in the near future? How precisely in detail do you decide what goes where?
Thank you, Mike, for your question. It's a very good one, and I can tell you that we don't decide around the cabinet table. It is not politicians who decide how resources are allocated. We rely on experts, on medical officials, on coordination between medical officials in all different provinces to make the determination on where things are most needed, and we follow the direct advice of medical experts in terms of how to ensure that everyone, everywhere, has the equipment they need.
Follow-up question?
So what input? Yes. So what input then are you looking for from provinces and municipalities as they struggle with this? And does this ramp up of Canadian production, is this a reflection that this has to be a made in Canada solution. We can't rely on exports or imports from the United States, let's say?
We continue to work very, very closely with the provinces to know exactly what the needs are, what the supplies are, where potential gaps might be appearing, depending on trend lines and different modeling. We are in constant communication to ensure that the resources needed in different parts of the country will get there exactly when they're needed. And on the second question, yes, on procurement. The entire world is trying to get its hands on the various equipment needed to fight this virus. That is why we know that it'll be important to be able to have made in Canada solutions. And I am incredibly, incredibly proud of Canadian companies, Canadian suppliers and manufacturers who are stepping up and saying, we want to help, we will help make ventilators, we will help make masks and gowns and all the things that we are going to need in the coming weeks. It has been a truly amazing and inspiring story to see how many factories and manufacturers are stepping up. In the meantime, we're continuing to work very hard on procurement solutions to get the items that we need for the coming weeks. Okay. Je suis d'abord extrêmement inspiré par ce que les
very much
manufacturiers et les
inspired
compagnies
by
canadiennes
what
sont
Canadian companies and manufacturers are doing. We recognize that there is a huge demand right around the world for this equipment, and it's important to have made in Canada solutions so that we can meet our own needs in the weeks and months to come. In the meantime, we are working with all the provinces to look at their needs and coordinate all of that work so that they get the necessary equipment when and where they need it. And at the same time, we are working on delivering that equipment in the coming days.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI, à vous.
Oui, bonjour, Monsieur Trudeau.
Good morning,
J'aimerais
Mr.
savoir,
Trudeau.
quelle assurance
I'd like to know what kind of assurances have you been given from companies, the 5 new companies you just announced, that this material will be available in time in order to meet needs. We are trying to expedite all those processes, but we also recognize that it will take a little bit of time, probably a few weeks, before that equipment arrives from our Canadian manufacturers. And that's why we are continuing to receive shipments of material from around the world. And yes, and with respect to Agicrom that will be producing N95 masks, how many masks are ready now or will be ready very soon? I don't have that information, but I know that there will be a press conference following this one where more information will be available about procurement.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir, à vous.
Good morning, Mr. Trudeau. I'd like to come back to construction work that is proceeding on TMX. You say that they are following medical advice, but there are some workers who are very worried about these people coming back into the region. Why not suspend that work to protect the residents? Well, we know that Indigenous communities in Canada are very vulnerable, and that's why special measures are being taken right across the country to ensure that COVID-19 does not spread to those communities, which are already quite stressed in terms of their own medical system and the number of people who live in housing units. So we know there's more that needs to be done. Now, with respect to construction work, I am confident that the company is taking all the necessary steps to keep people safe. My follow-up is on another topic. Now, with respect to the emergency benefit, Now, you're saying the CERB will amount to $2,000 per month, but what about someone who's on minimum wage? Are you not concerned that somebody or some people will want to get that benefit rather than continuing to work? Well, this is a very difficult situation, and what's important is to ensure that people can self-isolate and take whatever steps are needed to stay safe and keep their families safe. At the same time, we know that there are some jobs that are more essential than others, and I'm quite confident that by working with the provinces, that we will be able to ensure that what needs to be done continues to be done, and that Canadians have the money they need to continue to pay their rent and do their groceries. This is something we will continue to work on together.
We recognize that people need money to be able to stay home and pay their rents and be able to buy groceries. This is a situation that is unprecedented, and it was really important for us to get money into people's pockets quickly. We recognize that there are going to be challenges around certain essential services, and we're going to work with the provinces, and we're going to encourage people to find solutions that will allow people to stay safe while they continue to do the job they need to do.
Prime Minister, I'm wondering, you've talked a lot, and your cabinet ministers have talked a lot about there being enough protective gear for healthcare workers, but we're hearing from healthcare workers that they're being rationed and that they're concerned, that they're afraid to go into work. How do you explain that difference, I guess, between their perspective and the government's?
I think one of the issues that we're facing with is we're looking at a number of different models where worst case scenarios are fairly dire, but the expected track is reasonable and something we think we're going to be able to manage. I think healthcare workers and everyone needs to keep in mind what the potential worst case scenarios are, and that's why it continues to be so important, not just for us to prepare for every eventuality and be very careful and responsible about how we use the equipment we have, but also impress upon Canadians how important it is that the decisions you make today, whether you go out and how you go out, if you do go out, will have a direct impact on the need that healthcare professionals will be facing a week from now, 10 days from now. That's why it is so important for everyone to keep pressure off our healthcare system by staying home, by making sure that you're making smart choices to keep us all safe.
Pour faire un peu un suivi, M. Trudeau, bonjour, Christian Noël de
Radio-Canada. We have nurses who are saying that the hospitals are telling them to take those masks, to take them home and wash them and bring them back the next day. Is there such a serious shortage that healthcare workers should be endangering their own health? Well, I think we have to be prepared for any eventuality. I think that's the responsible thing to do, and we are looking at ways of ensuring that we have a proper supply of all equipment based on potential scenarios in the coming days. But I can assure you that we are working together to provide shipments of other equipment, and we are working with Canadian companies to produce more equipment. And once again, we are reminding Canadians that the choices that we make today, if we stay at home, or if we do go out, will have a direct impact on the demands placed on our health care system in the coming week. And that's why everyone has to do his or her part.
It's extremely important for everyone to do their part in staying home, in making sure that a week from now, 10 days from now, we aren't overwhelmed in our healthcare system. We are looking at a range of models that could lead to different outcomes. We're, of course, preparing for the worst case scenarios, but working towards and certainly hoping for a best case scenario. But that entirely depends on citizens being responsible in their choices. As for decisions made by medical professionals on managing the supplies that they have, I can only salute them for the work that they're working so hard and the decisions they're making to keep us all safe as a country and to keep themselves safe so they can keep keeping us safe.
Au niveau international,
Now,
il y
at
a
the
une
international
mini-guerre
level,
qui se
there's
livre
kind of a
présentement
mini
pour l'achat
war
de
right now where people are trying to get equipment. Does that concern you? Do you think that Canada could end up with a shortage? Are you concerned about that? Well, I think there are a lot of things of concern to us in this situation. The health of all Canadians, that's my primary concern. And of course, the health of our healthcare workers who are trying to keep us safe. We are working with our embassies internationally to ensure a proper supply of other equipment, and we expect to receive more equipment in the coming days. We will continue to be there to accept those deliveries, but at the same time, it's very important to mobilize industry so that we can get that equipment produced here in Canada and have our own supply chain mobilized here in Canada. And that's exactly what we're doing now. And again, I want to thank Canadian manufacturers and businesses who have stepped up to adjust their production and provide that equipment if it's needed for Canada and around the world.
We are, of course, working hard to make sure that we receive shipments of needed supplies in the coming days. And I can assure you that our embassy staff around the world is strongly engaged in exactly that. But that's also why it is so important that we have made in Canada supply chains to provide us with this essential equipment for the coming weeks, for the coming months. And that's why I am so pleased to be able to thank the manufacturers and producers across this country who've switched their production over to making this necessary medical equipment because it will ensure that we have solutions in Canada that will cover our needs.
Good morning, Prime Minister. Olivia Stepanovich, CBC News. The Americans are said to be most aggressively scooping up personal protective equipment on the international market. I'm wondering if you found that to be the case, and if so, if you have prevailed upon President Trump to work together to come up with a common North American strategy so you can quickly shift ventilators and other personal protective equipment across the continent to priority areas.
We are working very hard to ensure that Canada receives the equipment that we need, both in the short term and in the medium term, creates production facilities to ensure that we can cover our needs. We understand that countries around the world are taking their own approaches. We will continue to coordinate as much as possible, but every step of the way, our priority will be ensuring that Canada is able to take care of its own.
But are you working with President Trump on a North American strategy? And also, can you tell us exactly how much medical gear has been deployed and delivered so far?
We have been able to cover all our needs up until this point, and expect to be able to cover our needs for medical equipment in the foreseeable future. But that is why it is so important for us to ramp up domestic production as well. And with the United States, we continue to coordinate on a broad range of issues. We will continue
to coordinate our efforts with the United States on many different issues, but our priority will always be to ensure that Canadians have the equipment they need to stay safe and healthy.
Has been deployed and delivered so far?
That's a question for the ministers who will be addressing this a little later today.
Brian Mullen, Global News. Prime Minister, with rent due tomorrow, many small and medium-sized Canadian businesses are worried about paying their landlords. What can the federal government do? Is rent forgiveness in some shape or form on the table?
We've already worked with CMHC to ensure that many mortgages are able to be deferred. We've put more money in the pockets of businesses, or putting more money in the pockets of businesses through this wage subsidy, the 75%, that will take off a significant amount of pressure. We've also made available a $40,000 loan for small businesses through the banks that'll be interest-free for the first year, and as they go through it, $10,000 of it, under certain conditions, will be non-repayable at the end. So there are direct measures for companies to be able to get the liquidity necessary to get through the coming months, so that we can be strong once we get through this crisis at the end of it.
Two First Nations communities in Manitoba and other communities are requesting military hospitals be set up. Is this something that the government is contemplating for remote communities with limited access to health care?
We know that our military, the men and women of our military, are always ready to serve, to help in a broad range of ways Canadians who need that support. The field hospitals is certainly an expertise that the Canadian Armed Forces have, and they will make determinations, and we will all make determinations about how we can and where we can best help if it comes to that.
Hi, Prime Minister. Molly Thomas, CTV National News. Canadians, of course, are putting lots of money on their credit cards. They're raking up interest. Last week, you had mentioned that you had talked to banks about possibly deferring that interest. Any more movement on that?
Those conversations continue with the banks. We're also looking at ways of easing access to credit for individuals so that they can shift their bank balances and their credit card balances to a lower interest line of credit. These are things that we're continuing to work on because we recognize that Canadians don't want to come through this with impossible levels of debt, and we're going to be there to help them out.
In French, please.
We recognize that it's important that people not come out of this crisis even in more debt than before, and that's why we provided the emergency benefit and the wage subsidy for businesses to keep people on the payroll. We also know that we can work with the banks, and that's what we're currently doing in order to try and get some changes with respect to credit cards. We're also looking at easier access to credit for individuals so that if they borrow money, it will cost less.
Reports that after more than a year, China is going to allow Canadian exports of canola. Can you confirm that? And is this a thaw in relations between the two countries?
I think we're recognizing that we're in a global situation where it is really important for countries to work together. We have seen promising signs of positive relations on specific issues, and we're going to continue working to try and ensure that our farmers, our manufacturers, our exporters continue to have access to the markets around the world, even in this difficult time.
We will continue to work with our farmers and producers to ensure that they have markets for their goods. We also know that this is a time where people have to work together, and countries as well must work together. And I'm happy to see the positive signs that we can work together despite what is happening. Thank you.
And that is the Prime Minister of Canada giving his daily briefing to Canadians today, largely focused on procuring and creating the equipment, the medical equipment that will be needed, that is already needed by frontline health workers across this country right now. Before I get to my colleagues, though, let me give you an update on another story we were tracking at the end of last week. You might remember there were a lot of questions about the possibility that American troops would be deployed near the Canadian border, not at the Canadian border, but near the Canada-US border, in an attempt to make sure that there was nobody crossing with signs of COVID-19. In fact, we can confirm now that it is no longer under consideration, that the Department of Homeland Security has formally dropped that aspect of their request for assistance. And that's some information just coming into CBC right now. So that's not going to happen. And we certainly know that the Canadian government officials made their case very strongly to American officials that that was not needed and would be viewed as damaging to their relationship. And so, in fact, the Department of Homeland Security moving away from that change entirely. Let me bring in the host of Power and Politics, Vassy Kapelas, and the CBC's David Cochrane. Just wanted to close the circle on that story that did seem to be sort of petering out, to say the least, but it does seem that, and I'm not sure how exactly they came to this decision, whether it was Canadian influence or pressure, or whether they just decided it didn't make a whole lot of sense. Vassy, over to you, I guess, on the Prime Minister's announcement around Canadian companies stepping up to create some of this equipment and how the government moves forward with that.
Yeah, so a couple of things, Rosie, that jumped out at me. The first was, I think, a bit of sort of positive news, if there is any of it, in all of this. And that is that when we heard Minister Baines and the Prime Minister, I think it was just over a week ago, initially say, okay, we're going to retool everything, focus on COVID-19, let us know if you can help. Apparently 3,000 companies reached out to the government in that period of time to offer their help. The Prime Minister announced basically the formalizing of 8, I guess, contracts or work, the government is working with 8 various companies on moving forward with this kind of equipment, trying to manufacture this kind of equipment. When I'm saying equipment, I mean masks, ventilators, personal protective equipment, testing kits, all of that. And they put a dollar figure to it. They're going to spend $2 billion on it. The Prime Minister got a lot of questions, and rightly so, about sort of the international market for all of this, meaning there are so many countries right now trying to acquire the same equipment. And in fact, Olivia Stevanovich, our colleague, pointed to the United States, which is reportedly very aggressive in trying to acquire that equipment. And so what does that mean for Canada's ability to do so? The Prime Minister pointed to the significance of sort of a domestic ramp up in that kind of manufacturing, in that kind of production, and kept saying, we expect to have this equipment in the coming days. He also insisted that the current level of need is being met. So even though we keep hearing from various people in healthcare that they're worried about that not being the case in the future, he said that it would continue to be met in the foreseeable future. But I think there is sort of cause for scrutiny in that, line that we keep getting. It's in the coming days. It's in the coming days. I realize that it's a moving target, that this is a huge scale effort that hasn't been undertaken before, but there are no specific timelines about when this equipment will be received and in what fashion. And I think that in lacking that, it's difficult to know for sure that those needs, A, are being met, or B, will be met, and for how long. So there is a big question hanging over everybody right now when it comes to healthcare workers, personal protective equipment, the ability to do as many tests as possible, the ability to make sure that equipment is available. And I think that we are still lacking the specific timelines that would provide those assurances.
He did mention, the Prime Minister did mention $2 billion to help purchase the PPE for bulk purchases with provinces and territories, which is very different from, of course, how it's happening in the United States. And it is why they're also aggressive, because they're competing amongst each other rather than having any coordinated response. He also said it'll take a few weeks to get these companies that are switching over up and running. And that's why they are still receiving shipments from around the world. And again, David, saying that they are preparing for the worst case scenarios, not necessarily the best case scenarios, which is obviously not the nicest thing to have to hear as a Canadian, but you would rather, I think, that the government prepare for the worst and know that there are companies coming online who will be able to create this kind of stuff down the road.
Right, so there's a couple of things to unpack in what the Prime Minister had to say. The $2 billion that they're committing to buy these things is a commitment to buy. Some of it is already bought, but that is not $2 billion worth of gear already in stockpiles. That's an important thing to note. We have a news release from Thornhill Medical, and what their part of this agreement is to produce and deliver 500 mobile compact ventilator systems as part of Canada's response to fight COVID-19. So they've secured 500 ventilators there. What the Prime Minister was saying about what is essentially total chaos on the international procurement market is the big challenge right now. This industrial capacity to build ventilators, to make masks, to do gowns, to do hand sanitizer, that all exists in Canada, but it takes time to get ready. And so maybe this can happen in 2 weeks, just to use a number. That is a short amount of time in the lifespan of a company and in the lifespan of a country. That is not a short amount of time in the life cycle and spread of a virus like COVID-19. So the big question a lot of people have, and which we are definitely hearing from frontline medical workers, is there enough PPE and gear and masks to bridge Canada's health system to the point where the production comes on at a level of scale where supply no longer becomes an urgent pressing issue, because you will be able to accelerate it domestically and have it in place. The international market, the idea of working with the U.S., this is something where their hospitals are overflowing. You have an isolationist president in a lot of ways, and they are scrambling and competing, hospitals in New York bidding against each other. The ability to cooperate in any kind of a reasonable fashion with another country, I think, is highly unlikely, just given the state of play internationally. So Canada has to buy the supplies a company has, promise to buy their future production, to get that leverage with the company to secure those supply chains, while industry retools itself to do this made in Canada solution that the Prime Minister is talking about. So Nav Bains has worked quickly, the Industry and Innovation Minister, to get these contracts in place and to start mobilizing in this direction. Anita Anand, the Procurement Minister, that's the minister really under the gun right now, because she is competing in the most intense global marketplace for a finite supply of things, where some countries have put trade restrictions and export restrictions on this equipment. There's nothing coming out of the European Union right now, for example. We've seen some things coming from China that countries have sent back for being defective. So getting a Canadian supply chain up to Canadian standard is going to be key in dealing with this long term, because, Rosie, it's not just this wave. We've seen in the life cycle of virus pandemics, there's a first wave, and then a second wave, and sometimes even a third wave. So this spending continues into next year, because as we deplete these supplies, even with the rationing that is happening on the front line to slow the burn rate of masks and N95s, it's going to be important to have this future domestic supply chain in case this comes back in some shape or form.
And that's, again, part of the reason why government officials, the Prime Minister, again, telling people to physically distance, because the less, the more we can take the pressure off the health system, the less they have to use these things right away. I will just say one thing on banks, because it doesn't, and then I'm going to go to my colleague in Windsor, it doesn't really sound like the government is making any progress that they're willing to talk about here with banks easing up on interest rates, with whether it be credit cards, and even we've heard lots of problems around mortgage deferrals. So it's something to keep an eye on. I'm not sure why there is a lack of cooperation or what more the government can do to try and force their hand a little bit. But I know a lot of Canadians are struggling with those interest rates from their banks. So
Rosie, on that, it could just be the sequencing of how they have to do the programs. Using the banks to get credit and float money to companies could have been the first thing they wanted to get out the door, and then work on the interest relief stuff, because one is really urgent and one is important, but could maybe be number 2 on your to-do list instead of number 1.
So we'll ask more questions about that from the Finance Minister later today. Thank you both very much. We'll be back once we hear from our ministers up at the top of the clock at noon. We are learning more, though, today about some of the 65 cases of COVID-19 reported in the Windsor-Essex region of Ontario. Of course, that is bordering with Detroit, with Michigan, and 1/3 of those cases are healthcare personnel who work in the U.S. The CBC's Chris Ensing is in Windsor. We did talk to a nurse from Windsor. I believe it was you that flagged her to us, Chris, who was doing that back and forth work, and she was worried, but she seemed to be well equipped. But this is, of course, the big concern, that healthcare workers get the virus and then that they bring it back into Canada. So what are the concerns? Tell us more.
Yeah, let's start there with Jenna Maloche. So she lives here in the Windsor area and every day crosses the border to go to work at a Henry Ford hospital. Now, there's more cases in Detroit of COVID-19 than there are in Ontario, according to the numbers this morning. So that gives you a sense of how serious it is over there. Every day, Jenna comes back home, crosses the border. She's an essential worker. And when she goes home, she changes in her garage. She goes into a separate bathroom and wears PPE around her common areas to not get her family infected or at any chance of that spread of COVID-19. Now what's happening is there's this tension that's existing in Windsor-Essex about how we can make sure that our community stays safe and that these nurses, these healthcare professionals, approximately 1,500 of them who cross every day into Michigan to work on the front lines of COVID-19 are also safe. So our medical officer of health this morning laid out some new recommendations or suggestions that he's hoping to see. And one of them was the idea that if someone is working across the border, they stay in that country until their work week is over. So for someone like Jenna, that means she goes to Detroit, she stays there for the week, she comes back over. There was also an idea pitched by the NDP MP out here, Brian Massey, for additional screening at the border, so temperature checks, stuff like that. Our medical officer of health said that that screening already exists at the hospitals, so they don't see that that would be as valuable as finding a way to make sure that these healthcare workers who are needed, both in Windsor, there's ones in Michigan that come into our region, as well as those here that go into that region, to make sure that they're safe and that there's no community transmission. Again, as we deal with 1/3 of our cases here in Windsor-Essex coming from people who work in the healthcare industry in Michigan.
Okay, Chris Ensing, we'll keep an eye on that story. I know you will too. Thank you for that. Appreciate it very much. Let me just bring people up to speed on where we are and what we are waiting for now. Of course, our regular noon briefing from federal cabinet ministers and federal public health officials on efforts today. The message from the government really on how to procure personal equipment, protective equipment rather, for medical staff, frontline health workers. The Prime Minister naming a number of Canadian companies who have stepped up to switch over what they're producing in order to create a domestic supply chain for those medical supplies. And the government also offering up $2 billion to help purchase bulk purchases for provinces and territories that need help with that as well. We are also expecting later today more details on the wage subsidy for 75% of wages for companies big and small that lose 30% of their revenue due to COVID-19. All those details still to come. But for now, we will leave you on CBC Television. If you want to keep watching, we're on CBC News Network and CBC.ca. I'm Rosemary Barton. Hello again, I'm Rosemary Barton, live from Ottawa. Welcome to CBC News. You might be watching us on CBC News Network. You might be watching us around the world on the CBC News app or CBC.ca. And we are bringing you, as we do, all the latest COVID-19 coverage through the day. And in just a few minutes, we will hear from federal cabinet ministers and public health officials on Canada's attempt to contain the pandemic and how we are responding. We are also waiting today to hear more specifics from Finance Minister Bill Moore about the economic response to the pandemic. But just moments ago, the Prime Minister thanked the thousands of Canadian companies, 3,000 or more, that have offered to help the government secure much-needed personal protective gear, or PPE, the masks, the gowns, the gloves that frontline healthcare workers need to fight COVID-19.
We know that the demand for critical equipment and supplies will grow in the coming weeks, so we need a sustainable, stable supply of these products. And that means making them at home, and we're optimistic that they will be available in the coming weeks. So today, I'm also announcing that our existing next-generation manufacturing supercluster will be leading companies in developing and scaling up new technologies to test and treat Canadians. Demand for these goods is going up, so we're making sure Canada is ready to keep up. That's why our government is also allocating $2 billion to purchase protective personal equipment, including for bulk purchases with provinces and territories. This includes things like more masks and face shields, gowns, ventilators, test kits and swabs, and hand sanitizer. Protective personal equipment is essential to protect our healthcare workers who are on the front lines of this fight. We recognize that more is needed, and everyone is working day and night to receive essential supplies. We're coordinating with the provinces and territories, the Public Health Agency, and the experts to make sure our healthcare workers get everything they need. This is a priority for our government, and we will continue to source new solutions every day. We're expecting shipments to come in the coming days, and we will continue to work tirelessly to get these supplies to where they're needed.
Okay, so that's the Prime Minister's daily message and update for Canadians today. Power and Politics host Vashi Kapellas and the CBC's David Cochrane are back. Now, I'm sure, I obviously can't remember a time when Canadian industry all sort of joined hands to fight and create something for the good of all Canadians. I would imagine that would be, wartime efforts would be the only other example of that kind of thing. But I guess the concern, and we talked about it a little bit, Vashi, is will it be enough? And will it be ready? Which is sort of the obvious questions with this pandemic and the questions you always ask. But we know, for instance, that this week, Theresa Tam has said is a really critical week, the next 7 to 10 days, to seeing how we are doing in flattening the curve. So I guess they have to have as much on hand and have as many supply chains as they can in case things really are the worst case scenario.
Yeah, and I think, it's hard to gauge, right, exactly what the need will be, because it very much depends on the actions you and I and every Canadian is taking right now. And that's the message that we've heard from all public health officials throughout the country over the past few weeks. That's why staying home is so important. But what we do also continue to hear, particularly from healthcare workers, is if in fact this doesn't go as planned or as we hope, and things are leaning towards more of a bad case or worst case scenario, the need for that equipment will be greater than the supply. Now, that's not consistent everywhere, and it does depend on the province you're in. It does depend on the facility you're in. There are sort of a variety of accounts from people who are working on the front lines. But at the same time, we do hear that the need is there. So the message today was very much aimed at that. And I do want to highlight that the Prime Minister said that the needs were covered as of now and in the foreseeable future, but obviously announced, as you mentioned, Rosie, $2 billion towards procuring more of that personal protective equipment. What we don't know, though, is if the timeline of that equipment becoming available to Canada or being made here or however it gets into our hands will match up with the need, because we can't accurately predict the need right now. It's difficult to know if there's going to be enough, if the timing is going to work out. And there weren't really a lot of specifics today yet provided by the government on when that stuff starts coming in the coming days. Obviously, there's a lot of factors that go into it, but we just kept hearing in the coming days. So right now we have assurances from the federal government that the needs will be met, but we don't exactly know, even beyond just the foreseeable future, how great that need will be.
No, I mean, they keep saying we are, planning for the worst case scenario. We are over preparing. So, I mean, we'll take them at their word. But that is, of course, the question, whether these things line up. And I would imagine, given the modeling that they are doing based on the data they are receiving from provinces, they're able to, sort of plot out what that worst case scenario might be. It is interesting, though, to hear from different frontline workers sort of the vast differences in different places. I mean, we had an emergency worker on just before the Prime Minister spoke who felt totally safe and well equipped. But we've certainly heard from other nurses in other hospitals where they're rationing masks if people are not dealing directly with the ICU or dealing directly with those patients. Vashi, I'm just going to get you to touch once more before we get to cabinet ministers on that news from the Department of Homeland Security around the troops, because we spent a lot of time talking about it. We asked a lot of questions about it, and now it seems like it's not happening.
Yeah, so what the original discussion is there was a proposal from the White House to basically to militarize the border between the U.S. and Canada. And the idea would be 1,000 armed forces about 30 kilometers back from the border. That's what we were told last week was being discussed. It had been brought up, I think, just a few days prior to that. So we're looking at, let's say, the beginning of last week. In light of everything with COVID-19, the President of the United States addressed it at one point, speaking to the idea that he wanted to have sort of equal treatment of the southern border and the northern border. We know that immediately federal government ministers, such as Deputy Prime Minister Chrystia Freeland, Minister Harjit Sajjan, the Defense Minister, the Public Safety Minister Bill Blair, all sort of began speaking to their counterparts about it and pushing back on the idea. We were told by for example, new ambassador to the United States, Kirsten Hillman, that it would send a really bad signal, or a negative signal, considering that the border is demilitarized at this point. And what CBC was able to confirm today is that proposal is now officially off the table. So it had been reported, I believe, in the Wall Street Journal last week that they dropped the proposal just within about a day and a half after it came to light here in Canada. And now it looks like we have confirmation that is the case. So the U.S. is no longer, to sum up, moving forward with the proposal to arm or militarize the border between our country and theirs.
Such strange days, and stories move very quickly and come up and die away very quickly. I'm going to put you both on pause if I can just for a minute as we wait for cabinet ministers. Be back to you shortly. But first, we have been checking in with Canadians who've been infected by the virus, including some who are now on the mend, because that's happening, and that's a good part of this story, people feeling better. One of them is Jesse Riviere, and he joins us now from Montreal. Hey, how are you feeling?
Hey, how's it going? I'm feeling good today.
Good.
Pretty much symptom-free. So
tell us how you think you got COVID-19 and how you started to think, oh, I might have it.
So I traveled to Scotland with my wife on March 6th, and we arrived in London, where at the time everything was like normal. There, at least, like obviously the world was already dealing with coronavirus. but everybody was just, acting as normal. There was no precautions being taken. So we were there a few days, and then by the time we got to Scotland, I started to feel some chest pain. Nothing like concerning to the point of difficulty breathing, but definitely something that was out of the ordinary for me. And so kind of we just went through it. Then the calls came to come home, so we cut our trip short. That process, we were exposed to a lot of people through the airplane and the airports. So when I got home, I just kind of felt this chest pains continued. So I got tested and came back as positive. And then I realized that I hadn't been smelling anything for days. So, and that's a symptom that wasn't very publicized at that point.
Yeah. So the testing part was what? Because I've seen some diagrams of what it feels like and what it looks like. I don't know how detailed you want to get, but what did it feel like for the testing part? Or was it just non-invasive and no big deal?
It was uncomfortable, but for the, for the importance of getting tested, I had a tickle in my nose for like hours after. That was basically the worst of it, because they do put the swab deep in your nose, and that was, it was surprising. I didn't know that was going to happen, but a small discomfort to take for, getting the results and being identified.
So what was the worst then that you were? Just the chest pain, or did you have a high fever or headaches, or what other things did you experience?
Yeah, so this is the thing that's, as we learn more and more, it's coming out. Everybody kind of deals with this differently. And the fever, the cough, I think those are kind of more aggressive symptoms that are happening a lot. But in my case, just a light pressure on my chest. And obviously I lost the sense of smell. So that was like, if I would have known that was a symptom, that would have been a very clear indicator. At times the pain was like so acute that I was like, worried that it could be doing damage to my lungs long term. But thankfully, within about the 14-day, right towards the end, I started to get my smell back, and the pain has been gone from my chest for days now. So it seems like I can be added to the list of the 170,000 people worldwide who have gotten through this, at least who have, been tested and then gotten through it.
Yeah. You I don't think you're very old. You don't mind me asking your age?
I just turned 30 years old. Actually, I turned 30 years old at the Toronto Pearson Airport, arriving back my trip.
Okay, so it's a different kind of birthday, but there are, there is a concern that young people aren't taking it seriously. I don't know whether that was your concern. What would you say to some younger Canadians who are, who don't think that they will get infected, or who don't realize that they could pass it along to someone? Just a message, I guess, to people who are younger than I am, more your age.
Yeah, no, absolutely. I think that early on the messaging was that, young people weren't going to be affected and all those things. And I think that at least if you have a fear about getting ill yourself, generally if you're healthy, you'll be able to get through it relatively unscathed. But the thing is that you might have it and not know it, and then you might affect someone else, and then they might affect someone who's more vulnerable. And just by you thinking you can go about your life regularly, you might be responsible for someone dying. And that's a huge, huge responsibility. So, whether or not you even have any symptoms, you may be carrying it. So you just need to really stay home, figure out a way to amuse yourself, and just be responsible, because here you have a chance to actually make a difference. And it's not through anything more laborsome than, staying inside and making sure if you're going to go outside to be, smart about it. So, you can have no symptoms and still have this thing.
Jesse, that's an awfully good message for lots of people. I'm glad you're feeling better, and I hope your wife is doing well too. And I'm sorry your vacation got cut short, but I'm sure you'll get another one down the road.
Yes, thank you very much.
Thanks for taking the time to talk to us. That's Jessie Riviere, recovered now from COVID-19, speaking to us from Montreal. It's good to do some of those recovered cases too, because this can be a fairly grim story. So to know that there are people coming out the other side and are feeling better and doing okay, that's important for all of us to remember as well. As we wait for cabinet ministers and public health officials, I'm actually going to go back to David Cochrane, if I can, just for a moment, to pick his brain about what we might expect to hear from, I believe Navdeep Bains will be there, the Innovation Minister, and the Minister of Procurement. I'm not sure of her exact title. So they will tell us a little bit more about how quickly these new chains of supply can come online, I guess, David.
Yeah, and I think also some specifics on the numbers of what the amounts of the equipment that they've secured contracts on. Like, we know it's not in the government's news release, but we know from Thornhill Medical that they're going to build 500 of their portable compact ventilators. They mostly make a lot of medical equipment for battlefield and military circumstances, so they're retooling and scaling up the volume that so can be deployed to a more domestic situation. But I think the theme of what we're going to hear today, Rosie, is that the country is really on a national mission to buy two things: supplies and time.
Yeah.
And the supplies are in this globally competitive market that is really kind of crazy right now as they try to buttress the surge capacity that they have and what's already in hospitals, to buy the time until all of these Canadian companies that are answering the call and are retooling to deliver these supplies domestically and with certainty and in bulk, but they need time to get ready. Yeah. So some of the numbers we're seeing, Christopher Freeland's talking, I should stop talking,
That's
right?
okay, no worries,
Yeah.
I was going to cut you off in a minute, you're all good. All right, let's take you to the Deputy Prime Minister, Christopher Freeland, and other cabinet ministers speaking now.
Practice physical distancing. We must stay strong and stay at home. So unless you are doing essential work like stocking grocery shelves or working on the front lines of our amazing healthcare system, please stay home. You can go for a walk or a run, but maintain your distance and wash your hands when you get home. I know that this is very hard, but I also know that Canadians are resilient, and I know that we can do this.
This is a critical week in our fight against the virus. Canadians must practice social and physical distancing. Remain strong and stay at home unless you're doing essential work such as stocking shelves or providing healthcare services. You can go out for a walk or go for a run, but remain far from others and wash your hands when you get home. I know this is very difficult, but Canadians are resilient, and I know that we can do this.
So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Minister of Public Services and Procurement, Anita Anand, the Minister of Innovation, Science and Innovation, Navdeep Bains, et le président du Conseil du Trésor et le vice-président
and the President of Treasury Board and the Vice President of the Cabinet Committee on COVID-19, Jean-Yves Duclos.
Bonjour à toutes et à tous.
Good morning, everyone.
So I'm going to begin by an update on our number of cases. But I'm going to use the number that's published on our website as of 9 a.m. this morning, just because, as you know, this is a dynamic situation as different provinces are announcing different things as we speak. So in Canada, as of 9 a.m. this morning, there were 7,708 cases of COVID-19, including 89 deaths. So in addition, at any point in time, there are many other people under investigation, awaiting lab results, or not yet tested. So even if you're not hearing cases in your community, it doesn't mean that there are no cases and that there are no exposures waiting to happen. So we now have completed tests for over 236,000 people in Canada, with about 3.5% of people confirmed as positive and over 93% confirmed as negative. Pour le moment, la principale préoccupation
Our greatest concerns at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a correctional facility. These events are deeply troubling, both because they result in outbreaks that accelerate the spread of the virus, but more so because of the serious consequences for these high-risk individuals. However, the young are not spared from severe outcomes. Adults under 40 account for 10% of hospitalizations and just yesterday, there was a report of an individual in their 30s who died of COVID-19.
Our greatest concern at the moment relate to the introduction and spread of the virus in enclosed settings where vulnerable people reside. We currently have a number of ongoing outbreaks in long-term care homes, cases in First Nations and Inuit communities, and a corrections facility. These events are deeply troubling, both because they result in outbreaks that accelerate the spread of the virus, but more so because of the serious consequences for those high-risk individuals. However, the young are not spared from severe outcomes. Adults under 40 account for 10% of hospitalizations, and just yesterday, there was the first report of an individual in their 30s who died of COVID-19. We must prevent introduction into vulnerable population at all costs, as well as prevent new travel-related cases from sparking community spread. As all Canadians continue to strictly adhere to physical distancing to protect themselves and others, we expect all travellers coming into Canada to join these efforts. Moreover, because of an increased risk of COVID-19 outside of Canada, the quarantine order now in place requires these travellers go directly home upon arrival and quarantine themselves for 14 days. So we all need to keep up physical distancing while maintaining social connections. Thank you.
Okay, thank you very much, Dr. Tam. Now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Merci beaucoup, Christia, et bonjour tout le monde.
Thank you very much, Christia, and hello, everyone. As we continue to work through this truly extraordinary situation, I want to thank Canada's essential workers. Your work is helping to contain the spread of COVID-19, and we are incredibly grateful.
As part of these efforts, Public Services and Procurement Canada is aggressively buying in bulk from all available suppliers and distributors. To date, we have ordered millions of swabs, gloves, masks, and other vital equipment. I'll take a moment now to highlight additional progress that we are making.
We have signed a contract with Medicom of Pointe-Claire, Quebec, to provide an important supply of surgical masks.
Including this order, we have now managed to secure more than 157 million surgical masks to support the response. To date, we have also ordered more than 60 million N95 masks, a key piece of protection for healthcare workers. Delivery of these will begin this week. Nous travaillons également avec Spartan d'Ottawa.
We are also working with Spartan, the Ottawa-based company that will provide COVID-19 rapid test kits.
Spartan's Made in Canada kits will enable us to test many more Canadians over and above the millions of tests that we have already ordered. On ventilators, we have a significant order through Thornhill Medical in Toronto, part of the 1,570 ventilators that we have ordered from companies in Canada, Europe, the United States, and overseas. We are working to secure upwards of 4,000 additional ventilators and very possibly more. Canadians have always risen to the occasion in times of challenge, and the companies with whom we are working from every region in Canada and abroad are clear examples of this important point. I also want to thank Suncor and Home Depot for stepping up with generous donations of personal protective equipment. Nous savons à quel point ces fournitures sont importantes pour lutter contre
We
le
know
COVID-19.
that this type of equipment is very important in order to fight against COVID-19. We will be investing $2 billion additional dollars in terms of purchasing PPE as well as bulk purchasing in coordination with the provinces and territories.
These supplies are to the fight against COVID-19. PSPC will support the additional $2 billion investment in the Public Health Agency of Canada to purchase personal protective equipment, including for bulk purchases with provinces and territories. These funds will continue to be dedicated to purchasing the equipment necessary for our doctors and nurses, hospitals, and other frontline health workers across this country. Notre objectif
Our goal is to be as best prepared as possible, and Canadians can rest assured that we're exploring every possible option.
I also want Canadians to know that we are working together in these unprecedented times. I have reached out to my provincial and territorial counterparts to ensure that we have strong and established lines of communication with regard to procurement, in addition to the work that is already being done by ministers of health across this country. I
have reached out to my provincial and territorial counterparts to ensure we have strong and established lines of communication with regards to procurement, in addition to the work that is being done by ministers of health.
Extraordinary measures are required in these extraordinary times to limit the spread of COVID-19, protect critical infrastructure, and ensure that Canada has the supplies required. Our government is leaving no stone unturned. It is all hands on deck right now. Merci beaucoup. Thank you.
Okay, thank you very much, Anita. And now we'll hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Christia. A little over a week ago, our government announced Canada's plan to mobilize industry to fight COVID-19. Ce plan a comme but de fournir de l'équipement.
This plan aims to provide critical medical supplies and equipment to healthcare workers and prioritizes the health and safety of Canadians.
Since then, we've achieved considerable progress. And as Minister Anand just announced, we've advanced to the procurement stage with the 3 companies we highlighted last week. On Medicom, I will say that in addition to the immediate mask procurement, we are in the process of finalizing an agreement to support the development of manufacturing capacity in Canada. It's strengthening our domestic supply. That remains a core objective of ours, to make sure we have the ability to build these masks within Canada. Another part of our last announcement included a call to action, asking companies to step up in this fight against COVID-19. Well, as of noon yesterday, we have received over 3,200 emails from companies, and we've directly connected with over 2,900 of them. Whether it's companies with ready-to-go products, with products not yet authorized, or for companies whose products need a little more development or who need help scaling up. If you tell us you want help, we will connect you with the relevant federal support to ensure we increase domestic supply so that we have Canadian solutions ready to protect and support Canadians. We have now signed additional letters of intent with 5 companies who have signaled they can assist in the government's response to COVID-19, supplying testing kits, hand sanitizers, personal protective equipment, and medical apparel. As I said, we're refocusing our industrial policy and are deploying funds on an accelerated basis through shortened applications and faster approvals. We're committed to pursuing this strategy to do all we can to make sure that we help our healthcare workers. C'est encourageant de voir que les entreprises sont prêtes.
It's been encouraging to watch companies rise to the challenge, often joining others to equip our healthcare workers with the tools and protection they need.
We're also helping bring together industry partners, from the Cosmetics Alliance Canada to Canadian Consumer Specialty Products Association and Spirits Canada. Together, they're working to facilitate the supply of key ingredients to maximize the domestic production of hand sanitizers and disinfectants. Another important step that we've taken is advancing the Next Generation Manufacturing Supercluster initiative, which brings together more than 970 members into a Canada-wide manufacturing network. It recently put out a call for proposals to its members, and it's making $50 million available to develop and scale up new health products and equipment that are in short supply. And within 48 hours of issuing this call, the Supercluster reviewed and conditionally approved 3 projects for innovative manufacturers to produce ventilators, testing kits, and face shields. As my colleague mentioned, I also want to take this opportunity to recognize companies like General Motors, Ford, Toyota, Linamar, Magna, Shell, Suncor, Home Depot, and Canada Goose. All of them have contributed to the response by donating personal protective equipment and health supplies to local hospitals and medical facilities. And I encourage other companies to follow their lead in generously donating whatever they can during this challenging time. And let me wrap up by reminding everyone that we're in this together, and I'm proud of how industry has stepped up to fight COVID-19. Nous avons tous un rôle à jouer pour
We all have our role to play to flatten the curve and support Canada's economy. Thank you.
OK, thank you, Nav. Et maintenant, je donne la parole au
And now I give the floor to the President of Treasury Board, Jean-Yves Duclos. Thank you very much, Christia. Today, we're doing an assessment of 2 important strengths within the country and of Canadians. That is the capacity of the Canadian government to provide supplies and the capacity of the industrial network of this country to support this country. And so we've talked about this investment of $2 billion in procurement operations of the Canadian government to be able to buy medical equipment, tests, and accelerated tests in the purchase of PPE and disinfectant and hand sanitizers, in the possibility of buying medication to treat people who are ill, and also to provide ventilators. We're also speaking about the importance of mobilizing the production capacity of the government and of private companies throughout the country. Thousands of companies are mobilizing to support the efforts of the Canadian government to support the healthcare and public health agency activities, and the government is working with Public Procurement Canada to ensure and accelerate this collaborative effort between companies and the Canadian government. Thank you.
Et maintenant, on est prêt.
So now we're ready to answer your questions. So we're going to start with 3 questions from the phone.
Question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, faites étoile 1 sur votre téléphone à clavier. We have a question from Micheline Laflamme, Radio-Canada. Please go ahead. Votre ligne est ouverte.
Question. Thank you very much. I'd like to know whether your goal is to become self-sufficient for the production of PPE, or to become self-sufficient regarding certain equipment that's difficult to obtain on the international market, and what are the deadlines that you're looking at? I think that Anita and Nav will be able to answer those questions. Thank you very much for your question. We're working and collaborating with the entire government and in partnership with provinces and territories and industry in order to obtain the goods and services that we need in this extraordinary period. There are many things that we're doing at this stage. We're working through all methods possible to obtain all the essential medical equipment for Canada, and we're looking overseas as well to support our provinces and territories and Canadians and healthcare workers as well. And so perhaps my colleague would like to add additional comments. No, thank you very much, Anita. Our strategy is very clear. She's correct in that. We're going to continue to work with other jurisdictions in order to obtain the essential equipment that we require. But we also want to have a strategy for manufacturing here in Canada. And that's why today we announced that there are 3 companies that can manufacture the essential equipment here in Canada. So our strategy is to try and meet Canada's national requirements, but also we're going to try and continue to buy essential equipment from elsewhere in the world. Next question. Yes, thank you. As you talked about Medicom, you said that there might be an agreement shortly as to the construction of new companies. Could you be a little bit more precise in that regard? Answer. Yes, we are going to invest a lot of money. I can't confirm the amount at this point, but I hope I'll be able to do so shortly. But we're going to invest in a plant that's going to manufacture essential equipment in Montreal only for Canadians at the time, but I hope that they'll be able to manufacture for other jurisdictions, but it's for a priority for Canadians here.
So we are going to invest in Medicom through the Strategic Innovation Fund to produce masks here for Canadians, so we have domestic capacity. And the goal is not only to meet domestic capacity requirements, but ultimately to produce masks for other jurisdictions in the future as well.
Thank you, Minister. Operator, next question, please.
Thank you. The next question is from Briar Stewart, CBC News. Please go ahead. Your line is now open.
Yes, thank you. This question is for Dr. Tam. I'm wondering if there's any national tracking going on regarding the number of healthcare workers that have become infected with COVID-19.
Yeah, that's a very important question, and it is part of the data that we wish to get confirmed by the province and territory, so we're working very hard to do that. But of course, we do know of a number of healthcare workers, and particularly related to the long-term care facility outbreaks that you've heard about. Some of the health workers were the initial cases, followed by the residents. And so those are the kind of settings actually where that is going on. So we do have knowledge about those particular outbreaks.
And I'm just wondering, as a follow-up, I mean, we've heard from other countries where, you know, they're further down the road in this, that there are some times when doctors, as many as 1 in 4, are off sick at one time because of COVID-19. I'm wondering what kind of contingency plans are in place in Canada if that were to happen here.
I think protecting the healthcare workers in the first place is very important, and it will go all the way from health workers who had traveled. We need to pay special attention to them, making sure that they're not sick and that they're not spreading, of course, the virus in both their family context or in the hospital context. That's really key. So having processes that screen and stop infection from spreading in those healthcare institutions protects the health workers as well as the patients or the residences. Of course, the personal protective equipment that you've just talked about. But of course, as a health professional, I think we all have to also practice everything that we preach, including social distancing, protecting our patients and our family. But for sure, protecting the health workforce is absolutely critical. Secondly, is looking at surge capacity. So with the provinces and territories having already engaged medical colleges, retired healthcare professionals, students who are studying in the medical professional field, and all of those engagements are now taking place with provinces already engaging that kind of surge capacity as they need to do, for example, contact tracing for the public health side, as well as surge for the healthcare system itself. So that planning is extremely active right now so that we maintain that health workforce.
Thank you, Dr. Operator. Third question on the phone before we go back to the room.
Thank you. The next question is from Manon Cornelier from Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. J'aimerais...
Question. Good morning. Mr. Legault, the Premier of Quebec, said yesterday that he was going to try and see what he might be able to do for those people who are working in essential services. Ms. Freeland, you were referring to people who are stocking grocery shelves, and he was looking to see how they might be compensated because they place on a minimum salary basis and they're earning less than what the CRB would provide to them. So are you going to look at this option to see the people who are underpaid in the essential services sector such that they're not put in a very unfair situation? Answer. Thank you very much for your question. The priority for our government from an economic perspective was firstly to be certain that all workers can remain at home if necessary, or to self-isolate, or to help others, or children who are not at school, or other members of their family who might be sick, or to help workers who might have lost their jobs because of the impact of COVID-19. That was the first priority. The second priority, and this is what the Prime Minister announced on Friday, we wanted to help workers at work, to help companies to maintain the link between the employer and the employee. This is what we did as well. We understand that there are industries and sectors, including the essential services sector, whereby there is a situation where our country has an extreme need for those people to continue working in the essential services sector, but at the same time there are economic consequences because of the necessary policies that have been put into place, and the federal government is in agreement with Mr. Legault as to the consequences of these policies, and we must find a fair way to treat all workers in Canada, including those people who are carrying out essential work, such as people who work in grocery stores. Question, do you have a timeline or a goal in terms of providing this fair solution in the coming days, or will people have to wait and see? Answer. What we have already said, these are extraordinary times, and our government has understood that it's important to act quickly, and this is what the context requires. However, one of the consequences of adopting policies more quickly than in a normal context is the fact that we announce a policy and we start doing something in relation to it, but in the following days, we have to establish all the details surrounding such a policy. And this is exactly what we're doing. Today, I cannot announce the details concerning the situation that you have asked about, but I can tell you that we're in agreement with Premier Legault, who is doing excellent work, that this is an excellent situation and we must think about it and we must do something.
Thank you, Deputy Prime Minister. We'll start with the room. Dylan.
Has decided to send asylum claimants back to the United States on the basis of public health. Given that you can speak independent of the government, I'm wondering if you think this will help public health, if this is putting people at more risk, if we see people sneaking around to come in without reporting, and specifically, what did you advise the government about these crossings?
I think obviously in terms of both protecting whoever's crossing and the rest of the population is extremely important for managing this particular epidemic. So I think from our public health perspective, we're there to do the screening and making sure that together with CBSA, anyone who is sick is properly managed. Of course, a reduction in the number of travelers from any entry point can potentially reduce the introduction, of course, to Canada. And so it's just different layers of measure, I think. But I think that's partly it. And of course, we need to look after each other on both sides of the border as much as we working on our side. I think our public health officials on the other side of the border is also managing anyone who is sick as well.
And Minister Freeland, your government has talked about a nation-to-nation relationship with Indigenous people. We're seeing some First Nations ask for military support. I'm wondering if they're under the thumb of the provinces, if there's a disagreement with the province, are you going to work with a First Nation? We're expecting a flood risk in Manitoba this year. I'm just wondering if you would be prioritizing that over a request for a field hospital in a First Nations community.
Thank you very much for the question, and thank you for your real focus on Indigenous issues. We really appreciate it. Mark Miller and I were talking about your work, actually. So look, to the flood point, we are very aware that there are emergency situations in Canada every year, even in the years when we are not facing a global pandemic. And Minister Blair and Minister Miller have been working very hard with their teams, specifically, and I should also say Minister Sajjan, and we have been having discussions to prepare to walk and chew gum at the same time. And it's important for Canadians to appreciate that. Floods happen every year. We have been seeing more extreme weather events. And so we appreciate that we need to be ready to handle those potential extreme weather events, even as we continue to work hard to fight the global pandemic. That is the particular responsibility of the Minister of Public Safety, and he is definitely on it. The Minister of Defense and DND is very, very focused on the military's particular role this season and this year to defend and support Canadians, and that's why we heard from them yesterday. When it comes to Indigenous communities in particular, Minister Miller is very, very focused on the specific needs. We heard from Dr. Tam just now that we really appreciate the specific vulnerabilities of Indigenous and Northern communities, and Minister Miller is working closely with Indigenous and Northern communities to understand specifically what they need and specifically what we will need to do to support them. Nothing is off the table.
Merci, Madame la Vice-Première Ministre. Next question, CTV.
I think this is for Minister Anand and Bains. Just going back to the companies that you're working with to produce medical equipment and from other equipment that we're procuring, say internationally, when exactly are we going to see these companies produce equipment and get that in the hospital, specifically, like a timeline on that? And are we going to allow these companies to produce equipment that we then sell internationally or donate to other countries around the world?
I'll begin and then I'll hand it over to Nav. Thank you for the question. I want to begin by talking about what we do at Public Services and Procurement every single day, 24/7. We are purchasing a broad range of personal protective equipment. We've received already masks, surgical and N95 gloves, and hand sanitizer, and expecting ventilator swabs, gloves, and additional masks in the future. So we are taking a very aggressive and proactive approach to procurement every day. We are working 24/7, and this country has never seen procurement like it is occurring right now. It is broad-based and it's aggressive. And on that basis, I will say that the timeline is long. We are engaged in procurement immediately as well as in the long term to ensure that Canadians have the equipment that they need to keep frontline healthcare workers and beyond safe. And in terms of the particular companies, we are expecting supplies this week, actually, ventilators in particular. And I will turn it over to Nav, who can continue with the explanation.
No, thank you very much, Anita. Just to build on what Anita has said, we are dealing with global demand. And of course, we recognize that our global supply chains are also, there's enormous amount of pressure and they're unstable as well. That's why we are partnering up with industry to build domestic capacity. The Medicom example that I highlighted with you earlier is an example of how we're using industrial programming like the Strategic Innovation Fund to build up that capacity with the primary objective of providing essential medical equipment for Canadians. So these are Canadian companies that are retooling to provide solutions to Canadians, particularly for frontline healthcare workers and to support our healthcare system. And so that is our number one objective. In the long term, if we're in a position to build up such significant domestic capacity to help out other jurisdictions, I think it's incumbent upon us to consider that because this is a global pandemic. This is not about just protecting Canadian lives, but we have a responsibility to other countries. But right now, our primary objective is to recognize that global demand is going up, global supply chains are unstable. We need to build domestic capacity to protect Canadians, and that's exactly what we're doing.
And so they are mandated then to keep what they're producing here in Canada for Canadians.
So when we are, for example, in an arrangement with them to help them retool or rescale, clearly the objective is to make sure we meet with the demands and the requests made by the provinces and territories. That is the objective, saying we are going to help you scale up or retool so that you can provide those essential medical pieces of equipment, personal protective equipment for Canadian frontline healthcare workers. That is clearly the objective. But as I was saying, in the long term, because as Minister Anand just mentioned, some of this equipment is going to be made available not in months, but in weeks. We want to make sure that we provide that equipment for Canadian healthcare workers. And then down the road, if we're in a fortunate position where we have the ability to help other jurisdictions out, we should also consider that. But the number one priority is helping Canadian healthcare workers.
Okay.
Sorry, that was one question, one follow-up already. That was a follow-up. There's a lot of folks on the line. Julie, CBC.
My second question, though, was about...
It's one question, one follow-up, please. Okay.
Good, thank you. My second question was about... There have been numerous reports in Europe about masks coming from China being defective. The Chinese embassy here in Ottawa tweeted the Bank of China has donated us some masks. Are we doing any checks to make sure what we're getting from China is effective and functional?
Well, I thank you for the question. And obviously that question pertains to goods across the board, not only from China, that public health has specifications and requirements that need to be met in order for PPE to be distributed and utilized safely by frontline healthcare workers. And so I will say that once the shipment comes in, and I'll ask Dr. Tam if she'd like to add in on this point, there is inspection to make sure that the specifications are met. In addition, we are making sure that in China there is quality control on the ground there. I have been in close touch with Ambassador Dominic Barton actually every single day to make sure that we have people on the ground in China who are assisting us with our procurements there, and they are performing an excellent and very useful service for Canadians on the ground in China, and that makes the procurement process in many, many respects much more smooth. Dr. Tam?
Yes, I can confirm that any kind of donation, we will need to make sure that we meet the standards in Canada. So Health Canada, who's the regulatory authority, has posted those criteria and guidance, but each of those donations will be checked in terms of whether they meet the standards.
Julie, CBC.
Yeah, hi, Julie Van Dusen, CBC. I'm not sure if it's for Ms. Freeland or for Dr. Tam, but we know that about a third of the 65 COVID-positive cases in Windsor, Essex are Canadian healthcare workers who cross the border, they work in Detroit, they come back with the virus. So the question is it time to stop the back and forth, or is there another way to deal with it?
I'll start that answer because actually last night I had a very good conversation with the mayor of Windsor about precisely this issue. He is very focused on it, as are the local MPs, and he has been in very close touch with he reported to me that he's been in close touch with both the Canadian hospitals and the U.S. hospitals. It's a measure of how closely intertwined our economies are, that there are in Windsor both Canadian healthcare workers who every day cross the border to work in Detroit, and there are also people who cross the border from the United States every day to work in the Canadian healthcare system. Stepped up measures have been put in place at the hospitals, both on the U.S. and Canadian side of the border, to very carefully check the health of the healthcare workers to be sure when they go to work and when they leave work that they are healthy and well. And also opportunities have been offered to them if they would prefer not to go home to their families to be able to stay in hotels close to where they are working. So a lot of very hard, very important work is being done on the ground in Windsor. And I really want to say the mayor is completely on it. And I want to thank him for his hard work. It is a situation that we are monitoring closely, and we need to monitor closely, and we are going to continue to do that every single day. And if Dr. Tam wants to add something.
I think just to add that we're also connecting with Ontario and their public health officials in terms of the sort of procedures and guidelines that they're putting in place as well for healthcare workers, but not much more to add. Thank you.
My second question is to either Ms. Freeland or Dr. Tam. And again, it's the fact that for the past few days, everyone's been saying this is a crucial week to see if physical distancing, staying at home, self-isolating is working. I guess the question is, what happens if it's not and infections continue to rise? Is there a plan B?
Look, I'll start. Just to say, we all need to be prepared for the reality, which is the situation is going to get worse before it gets better. That is the unfortunate truth of where we are right now. I'm delighted by the way you framed your question, Julie, because it shows that people are understanding that we can actually make a difference. You know, we mustn't be fatalistic about this. And if we take the right actions, we can have the least bad outcome for Canada. And taking the right actions means, first and foremost, Canadians every day practicing physical distancing. This is a particular kind of crisis where every single person in the country can make a difference. And I know that people are trying really hard, and I can't emphasize too strongly the need to do that. So I think the first answer to the question is, let's do everything we can, and each one of us has real power here to avert the worst case scenario. Having said that, of course, it is incumbent on all of us in government to do everything we can to prepare for a less good outcome. That's why you've heard today from Anita and Nav on the truly extraordinary efforts we're making in procurement internationally and getting Canadian companies who have been terrific, working hard to build what we need at home. I also really want to commend the work of premiers across the country and to give you a sense of how focused the premiers are on being ready for worst case outcomes. I can tell you that just this morning, I was on a conference call with Doug Ford and Francois Legault, which Premier Ford organized himself on his phone to work on procurement. And I had a text from Premier Horgan also with very specific questions. So this is a real Team Canada effort. The premiers are doing extraordinary work. We are getting ready for a less good outcome. But at the same time, even as we say that, let's all of us remember that what we need to do today is do the best we can to avert that. And I think we would all love to hear from Dr. Tam as well about this.
So I think our strategy, I think as I've explained before, twofold. One is everything we can possibly can to flatten and extinguish that initial wave as much as possible. And then the other thing is increasing any healthcare capacity that we can to manage the situation. But everything that we're seeing today in terms of cases would have been people who were infected retrospectively a couple of weeks ago or more. We also instituted public health action and measures that's really ramping up around the sort of March, the sort of 12, 13, 14, and then the week after that. When I spoke to and have these very intense discussions with chief medical officers of health, we stuck to the basic, absolutely trying to double down on the measures that we think works. One is, as we've all said, we need more lab testing. And even though Canada is actually testing quite a lot of people, we want to do more. That is an absolutely critical area, and pulling out all stops to do that. Because identification of cases and then managing the close contact is the key to the public health response. So we've been thinking of how do we make sure that every jurisdiction has the resources they need to do that contact tracing. Contact tracing is quite intensive. If you get a cluster or outbreak, you then have to trace all the people who may have been exposed. Is a really, really important aspect, so doubling down on that. Also, the concept of reducing and extinguishing this first wave is predicated by the fact that we want any infected individual to not pass it on to more than one person, that R0 or R0 concept. If one person that's infected passes it on to two, your epidemic will continue. So that is an ultimate goal. So to do that, this is why essentially social connection, but physical distancing is so important, and for Canadians, because you want to reduce that risk of transmission. And that's why that aspect of the response is so serious. So you've seen across the country, the public health system beginning more and more to restrict those movements in some way. So mass gatherings, when we started, absolutely we shouldn't be going to conferences or these mass gatherings, and then it went down to 250 and then 50, and now pretty much everyone's saying, look, we need to really buckle down and do our maximum sort of physical distancing, making sure vulnerable populations stay home and support them so that they're not at risk of infection potentially in the community or other settings, and all the sort of essential services, having them make sure grocery stores or other places where people do have to visit are also practicing social distancing measures. So that is so important. That's where I think as we speak, we're still enhancing those measures, and we'll want to see the effect of those, absolutely. And then, of course, at the same time, preparing for the scenarios where you can get increased influx of patients, alternative sites for evaluating patients. How do you house people who are mildly sick but can't be self-isolating at home, having hotels and other things. Homeless shelters cannot manage these outbreaks, so you need alternative sites to manage and isolate people from those vulnerable settings. All of this is happening right now. And so I think that's why I say this week, again, double down and keep going. Is the whole of society response.
Thank you. Operator, sorry. Operator, we'll take 3 more questions on the phone, please.
Thank you. The next question is from Raymond Filion, TVA. Please go ahead. Votre ligne est ouverte.
Raymond Filion from TVA. Question. Good afternoon, everyone. Doctors and nurses who are on the front lines and hospitals as well are afraid of a lack of masks. Premier Legault is talking about a lack of masks in the next 3 to 7 days. Is there a danger in that regard?
Merci beaucoup.
Thank you very much. Answer. Thank you very much for your question. It's tremendously important to have masks and other equipment for doctors and people who are working on the front lines. And I want to assure you that we've obtained masks of different types of masks for the workers.
As I mentioned, we have ordered 60.9 million N95 masks and 157.5 million surgical masks, and some of those are being produced right here in Canada. Donc oui, c'est très important.
So it's tremendously important, and we're working extremely hard to obtain the equipment for Canadians. Question, but my question is whether there is a danger of a lack of masks. So is there a danger, a risk of a shortage?
Maintenant, nous travaillons chaque
Answer. At the moment, we're working night and day to purchase
so that
masks.
There will not be the risk, and we are working very hard to make sure that we have that equipment to distribute not only to Quebec but to every single province in this country. And I will add that our efforts are supplementary to the efforts that individual provinces themselves are making. And so, c'est Équipe Canada, as Christia said, we are working as a country with the provinces every single day to make sure that we have the equipment that frontline healthcare workers and others require to keep our country safe and to fight against COVID-19.
Si je peux le dire rapidement.
Answer, if you'd allow me. Hello, Mr. Fillon. If I can reassure you, what you're hearing this morning is that the procurement capacity of the Canadian government and the industrial capacity of Canada are mobilized to overproduce materials and equipment to ensure that we have the maximum production of PPE and other equipment that healthcare workers absolutely need. Of course, we're supporting the work and the essential activities that the provinces, including the Quebec government, are undertaking, because we know that there is sufficient supply, but there is this current concern of being overprotected and overproduced, such that the industrial capacity of the country can provide sufficient quantities of PPE. Thank you very much. Next question.
Thank you. The next question is from Philippe Vincent Foisy.
Next question from Philippe Vincent Foisy from Radio-Canada. The floor is yours. Mr. Duclos, just to clarify what you just said, I'm not sure I understood. Are you able to say that 2 weeks from now, if we have an increase in cases as we're seeing at this point in time, that 2 weeks from now, all the nurses, doctors, and patients who need a ventilator will have the necessary equipment? Is that what you're telling us? In 2 weeks, 3 weeks, everybody will have the equipment. We won't need to make difficult decisions relating to ventilators? Answer. What we're saying is that we have to produce the maximum capacity of Canada's industrial abilities, and so we're going to produce a great amount in the next few weeks, but at the same time, we have an individual responsibility to have the best scenarios. But at the same time, the Canadian government must mobilize all the industrial capacity of the country to ensure that we have the maximum amount of resources in the coming week, and such that we'll be ready for any type of scenario that must arise. Question. But I just asked one question only. I'm sorry, I miscounted. Yes, follow-up question. Can we say to Canadians that the government promises that we'll have equipment for the worst-case scenario? Answer. We like you a lot, Mr. Fillon. We're having trouble hearing you because of the breakup in your speech. But at the same time, what we can say is that the Canadian government is ready to mobilize as if we were at war. And so we're mobilizing all our efforts, industrial and the government efforts, to ensure that the equipment is provided to provinces and territories in the coming weeks. We're working with the provinces and the territories to ensure that that equipment is available, but at the right time. And we have confidence in that collaboration between the government and the provinces. And of course, when we're talking about the worst-case scenarios, we hope that if they were to occur, that they would be the best-case scenario possible. Next question.
The next question is from Mélanie Marquis de la Presse.
From Mélanie Marquis from La Presse. Question. Thank you very much. My first question is for Minister Freeland. I'm wondering if you have an update to provide as to the refoulement of migrants to their countries of origin when the United States sent them back. Do you have any information in that regard? Answer. I can tell you that this is a significant and important issue for us. The work is continuing on. I was speaking to Minister Blair last night and this morning regarding this issue. He is very committed and engaged, as is our Ambassador Kirsten Hillman in the United States, who is engaged in this issue with our American counterparts. And I can reassure Canadians that the government takes seriously our international obligations concerning asylum seekers, and Canada will never do anything that will go against those obligations. Mr. Duclos, question. When we talk about the role of big banks in establishing interest rates for the credit cards, sometimes they're 20 to 30% interest rates. What would you like to see from these large banks to ensure that Canadians don't become further indebted? Answer. What we want to do is to expect that the banks, including Mouvement Desjardins, committed to deferring interest and capital payments on mortgages. People are often stuck and don't have the means to pay their mortgage as they would do in normal times. But what we're expecting from the banks and from Desjardins is not only to be aware of the precarious situation of many families in Canada, but also to ensure that the way in which they provide loans through credit cards or other means be adapted to the present context. We know that credit cards lead to very high interest rates. In normal context, people would have trouble reimbursing those interest rates. So we're expecting that they would offer to individuals other means to pay back their loans and to pay lower interest rates in the coming weeks and months. This message has been explained to the banks and Mouvement Desjardins, and we hope that this message will lead to practical situations for families throughout the country. Thank you. One last question.
Thank you. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead. Votre ligne est ouverte.
Hi, good afternoon. Thanks again for doing this. My first question is for Dr. Tam. Right off the top, you mentioned specifically now cases within Inuit and First Nations communities, and I'm just wondering if you could please provide any more specifics on which communities you're talking about with confirmed cases, or what regions of the country if you're not able to provide that level of detail.
Yeah, there's a number of communities. I mentioned yesterday that Nunavik, which is in the northern aspects of Quebec, had experienced their first case, and some large First Nation community in Ontario, and also I believe in some of the prairie provinces. So even one case in any of these communities is extremely serious, and the leadership in the communities have taken very rapid action in terms of some of those social distancing and restriction of movement measures within the community. And of course, colleagues from Indigenous Services Canada are in close touch to look at what needs there are. But and also as we are reporting, not necessarily specifically Indigenous communities, but the north of Canada. So Yukon and Northwest Territories both have cases. And so, and they are introduced into the community from travelers. And all of those, all the Northern Territories are taking very aggressive public health measures to try and prevent introduction, but also adapting what social distancing means in those communities, particularly where they have crowded living conditions, looking for alternative sites, for example, in managing their situation. And also the health system is also revving up to look after different patients, and having very close planning with provinces that are linked to them in terms of medical care and transportation. So all that planning is being done, but any single case in those communities, we have to really take it extremely seriously.
And just as a follow-up, the Indigenous file is a big part of the work that I do, and in speaking just in recent days to some leaders, for example, in Northern Ontario, I've heard that they have 0 test kits in some communities, and I'm just wondering, if we can't figure out who has COVID-19, if there are no test kits available, how can we really get a handle on how widespread this is and also treatment? I know testing is an issue in a number of different parts of the country, but it seems as though there is serious concern from leadership about their capacity to test at all.
Yeah, and they'll be linked to the bigger system of the provinces and territories as well. But I think there's absolutely a gap that we have to fill because even the samples have to be flown vast distances to referral laboratories. So one of the priorities that we have right now, and we're evaluating some testing mechanisms where they can do that much closer to the patients. And so the National Microbiology Lab is now actually doing some of those tests on those kind of much more near patient test kits that can be used. And that's actually happening right now. And we'll give you some more information as that progresses. But the goal, of course, is to then equip the territories or the more remote areas with their own capacity so that they don't have to transfer specimens.
Thank you, Dr. Ceci met fin à la conférence de presse pour aujourd'hui. Thank you, everybody.
This brings the press conference to an end. Thank you. I just have one last thing.
Okay, and that is the end of the federal press conference by cabinet ministers and public health officials today. The main message about how the federal government is working with private industry to ramp up procurement of medical equipment that will be needed now and in the weeks ahead. While we were doing that, Quebec was giving us a briefing where they have 732 new cases, an additional 6 deaths. But we want to take you now to Toronto. The Ontario government is speaking about its response to the coronavirus and notably that schools will continue to be out until May 4th. Here's Premier Doug Ford.
And slow the spread of COVID-19. We're working closely with the school boards to find ways to help students complete the school year so they can advance to the next year and earn credits and graduate. We're easing the financial burden on university and college students and their families by providing a 6-month grace period through the Ontario Student Assistance Program. These new measures will help students continue their studies and get their diploma. We'll get through this for our students, for families, and for seniors, for everyone. And we will succeed thanks to the outstanding efforts of our many Ontario heroes. This isn't about our government. We have an army behind us, an army of 14.5 million people, the hardworking people of this great province. That's what keeps me going day in and day out. That's how I know we will get through this. The frontline healthcare workers coming in day after day, the businesses and workers who are stepping up, keeping vital parts of our economy going, and retooling to make essential supplies right here in Ontario. The teachers going above and beyond to keep students learning. And most of all, every single person out there that are taking our advice, staying home and doing their part. We all need to be rowing in the same direction, and together we will get through this. Thank you. And God bless the people of Ontario. I'll hand it over to Minister Lecce.
Good afternoon, everyone. Bonjour tout le monde. As the Premier made clear, we will do whatever it takes to keep students and staff safe from COVID-19. And based on the most recent advice from Dr. David Williams and the COVID-19 command table, our government confirmed that publicly funded schools will remain closed until May 4th. We're taking the next steps to provide continued learning for our children by unveiling a new teacher-led program that will keep students learning while at home. Nous veillons à ce que les élèves continuent d'apprendre tout en comptant sur le soutien et de leurs enseignants. The second phase of Learn at Home creates some predictability for our parents, our students, and our educators. We're providing expectations that parents can count on. We're enhancing support for students. We're ensuring the teacher-student relationship is restored. throughout this period of school closure. Our aim is to provide all of them with some sense of stability and hope amid this difficulty. These are extraordinary times. We're moving quickly with two aims in mind. The first, to keep your child safe, and the second is to keep them engaged in learning. And I know nothing about this situation is ideal. And we recognize the difficulty that parents will face as we go forward. This pandemic has perhaps made the case so clear. We must come together, harness our collective energy, put our efforts forward to improve the situation of every child and keep them safe from COVID-19. And we are with you, providing the guidance, the resources, and the support to ensure you get through this. Today, the Premier announced the next phase of our ambitious plan to keep students engaged in learning. With phase 2 of Learn at Home, we're laying out a new set of expectations that parents and students can count on, including first and foremost about reconnecting students with teachers and other school staff, including mental health workers, something parents and families have called on. We're ensuring the reestablishment of teacher-led learning with specific expectations for students and teachers by grade. We're requiring final report cards for all students from kindergarten to grade 12, meaning this material will be graded by your teacher with the appropriate flexibility built in as we respond to this unprecedented challenge. Students can and will continue to complete credits underway. This is especially important for senior level students. We're also prioritizing students scheduled to graduate and supporting students on their track to graduate. We're leveraging digital resources. We're embracing all forms of student-teacher connectivity based on the student's access to technology, meaning one way or another, by printed materials or tablet, every child should and will be able to continue learning through the curriculum supported by their teacher. We've also developed a training program for educators to support them in virtual learning delivery. It's clear we have to strengthen the capacities of some educators using online tools. Many do this already, and they do it well. Now our aim is to ensure all teachers have that professional development to improve for their kids. We recognize the importance of ensuring all children can learn and get ahead through this period. And we're working hard to bridge those gaps to ensure that no child falls behind. In partnership with boards of education, we're distributing laptops or devices from schools as needed. And at the ministry level, we're working with telecommunication partners through the Ontario Together portal to leverage the ingenuity and support to get technology to those that need it. We're also ensuring students with special education needs get the support they rightfully deserve. These parents are truly working so hard to support their children at home. And I want them to know that we recognize this difficulty. And that is why we are providing additional parent supports and guidance for you. Moreover, we're working hard to immediately activate the education assistants and other professional staff to support these children and their families and their educators. We know that a lot of these supports are designed for in-person instruction, but we will do whatever it takes to help your child, even if it means untraditional methods of delivery. We will never lose sight of those kids today or into the future. We also know that mental health challenges are real, facing many students, especially anxiety and confusion about what this all means to them and to their future. We're actively supporting Kids Help Phone and encouraging kids to reach out and to text the word CONNECT to 686868 right now if you're in need. We're also working to immediately unleash the full supports of mental health professionals, including psychologists and psychotherapists, social workers, to start connecting with students in a secure manner. You know, folks, the summary of this plan is that we will do whatever it takes, moving at lightning speed to give your child the education they deserve. We're doing this in partnership with directors and chairs and trustees and administrators and school boards, in partnership with teachers and worker unions, and with you, the parent. We're all in this together, and it will require all of us to work together for the good of our students, because these are unprecedented times. We are approaching the continuity of learning through an iterative lens. If we can protect some of the school year, should it be safe, then our instinct is to do so. If we can salvage part of the year for in-school instruction, of course, following the advice of Ontario's Chief Medical Officer of Health, then we will. Our aim is to be flexible to respond to the fluid reality of COVID. However, make no mistake, only if it is safe. If it is not, and Dr. Williams recommends a further extension, then we will do so as we have done in the past. Before I turn it over to Minister Romano, I want to speak to the students in grade 11 and 12, those who look to graduate in the months or even the year ahead. To those students watching and to their parents, we will do whatever it takes to ensure you graduate, full stop. And I'll continue to work with my colleague, Minister Romano, to ensure that there will be no barriers to accessing post-secondary pathways. We have your back, and we want you to succeed. Finally, I want to give a shout out to the entire school community for rallying our frontline workers, rallying behind our frontline workers. Boards from Toronto to Halton to Upper Grand have donated significant amounts of resources and equipment to support the government and local health authorities to counter COVID-19. Thank you for our partners for your continued collaboration. This is the spirit of Ontario. It's a reflection of the deep-held values of Ontarians, to be generous, to be grateful, and to be optimistic. We will overcome this challenge, and we'll do so together. Now, one of the partners in this ministry is working with Minister Romano, who's a father and parent who wants all of our children from elementary to post-secondary to succeed. With that, I'll turn it over to my colleague, Ross Romano.
Well, thank you very much, Minister Lecce, for those words and for that introduction. And I also want to thank our Premier so much for his leadership, his commitment, his hands-on approach that has been so critical in navigating through this crisis. I also want to thank Ministers Phillips and Elliott.
You've been listening to the Premier of Ontario and the Education Minister providing us with the news that students in the province of Ontario will not be going back to class until at least May 4th, and that could be extended beyond May 4th, May 1st for teachers, and that beginning next week, there will be teacher-led online learning for students in the province of Ontario. We should also tell you about some news coming out of Quebec. There has been a big surge in the number of COVID-19 cases in that province, with about half of the cases now in the province of Quebec. 732 new cases, 6 additional deaths for a total of 4,162. The Canadian total is 8,486. Let's listen.
I will start with the overview of the last day. We unfortunately have 6 new deaths, a total now of 31. So, of course, I offer my condolences to the families and loved ones of those victims. These are not statistics, these are real people. We now have 4,162 cases that have been confirmed. That is an increase of 732. We have 286 people being hospitalized. That is an increase of 51. And we have 82 people in intensive care, an increase of only 4. So that is the good news of the day. Very few people, keeping in mind the proportions, who are in intensive care. Our great priority right now is really everything that has to do with the medical equipment for protection. I'm talking here about masks in particular, the procedural masks. I'm talking about gloves, the gowns. Every day we have a very detailed overview with the Ministry of Health, the General Secretary of the government, who is also involved. And today, I want to be clear. I want to tell you the truth. For some of the equipment, we have for 3 to 7 days. So it's pretty tight. However, we have orders that should arrive in the next few days. And we have good hopes to be able to get through. So I don't want to worry anybody needlessly, and I also want to take advantage of the opportunity to thank my friend Doug Ford, who accepted this morning to transfer to us certain equipment. So I really appreciate this gesture on the part of the Ontario Premier. I also wish to thank Justin Trudeau, Chrystia Freeland, who are working really hard at securing certain orders from foreign lands through embassies. So thank you very much for your help. I also wish to salute businesses. There are a lot of businesses that have masks, amongst them the Jean Coutu Group that has 1.3 million masks. They have accepted transferring them to us. However, I want to repeat the message that I've been giving for a few days to the health care staff. It's very important, if we want to be able to have masks during the entirety of the crisis, it's very important that we use the masks only when it is essential, when it is necessary that we use them. Danielle is, together with her team, sending guidelines about when to use them, how to use them, but it's more important than ever. And listen, we're no different than anybody else. If you've been listening to news, whether it be in the US or in Europe, everywhere there is a race to get the equipment to protect our people. We are no different from others, and of course we have to be able to have them in what we call the peak, when we get to the peak of the curve. So we're all in the same situation. Today I'd like to also send a special message to those people who are isolated, the people who are alone. It's normal that you're finding it difficult on a daily basis, and that is why today I'm asking everybody who's not alone, who are lucky enough to be living with somebody, a spouse, a family member, parents, children, please call somebody who's alone today. Give yourself that as a task, as a responsibility. I was telling that to my 2 boys yesterday. Call your grandmother. It's going to make her happy. It's that simple. If everybody calls one person who's alone today, I think that it will make a lot of Quebecers feel good. My daily thanks, I really want to give them to our researchers. We have a lot of researchers right now in Quebec who are working night and day to be able to find medication, vaccines. I'm thinking about Dr. Tardif, amongst others, at the Institute for Cardiology, and I would like to take this opportunity to give out a message in his name. Right now, he needs thousands of participants for his research, for his studies. It takes people who have COVID-19, people who are infected. So we're going to put the coordinates of Dr. Tardif on the government's website, but it could allow this to save lives. So if you have COVID-19 and you accept participating in this very promising research of Dr. Tardif, and I would also like to take this opportunity to thank all the researchers, the men and women who have been working on a lot of different projects and who we hope are going to lead to something fruitful very quickly. And I would like to end with 3 priorities. Don't go out unless it's absolutely necessary. If you do go out, keep 2 meters between you and any other person. And when you come home from your walk or going to the grocery store, you wash your hands with soap for 20 seconds. I think that if we respect that plan, we are going to be saving the lives of Quebecers. So it's worth doing it, and I count on you.
My biggest concern right now is for the medical supplies. Currently, for some equipment, we have only for 3 to 7 days. New shipments should arrive in the next few days, and I want to thank my friend, Premier Doug Ford, who accepted this morning to transfer us some equipment. So thank you very much. I want to thank also Prime Minister Trudeau and Deputy Prime Minister Chrystia Freeland. They are working very hard to secure some orders in other countries. So thank you very much. It's very appreciated, and it's really the top priority right now. Make sure that we'll have enough medical supplies in the next few weeks. And I want to ask again to the health professionals, please use only the supplies when it's necessary. So to get through this fight, we must remain united. Today, I ask Quebecers to give a call to someone who's alone. I know a lot of people are currently suffering from isolation. A phone call can make a big difference for them. We must also continue to follow our 3 priorities. 1, don't go out unless it's necessary. 2, if you do go out, keep your distances. And 3, when you come back home, wash your hands. That's all will save lives. Thank you all.
Merci, Monsieur le Premier ministre. Alors pour,
Thank you, Mr. Premier. Now for the question period. Mr. Premier, Ms. McCann, Mr. Arruda. There's a movement being drawn right now supported by doctors of the CHUM, amongst others. Dr. Boubez, who is head of orthopedic services at the CHUM and who is suggesting wearing the mask for the population in general. There's a movement starting right now called Masks for All, not to protect themselves from COVID-19, but to avoid transmission